All right, good afternoon. Welcome to the webinar today on the NIH Directors, Broadening Experiences in Science Training for the Best Award. This is an informational webinar run by NIH, and you should all be able to see a slide in front of you that shows this title and an email address. So that email address is being monitored live during this webinar, and we'd like you to send your questions in as things arise, or if you have something you want to say during the webinar, you can email to that address and we will get the message electronically. Unfortunately, we can't hear your voices, but we're hoping that you can hear ours. Okay, I'm Trish Lebowski, and the agenda is on this next slide here, and this is what you're going to hear today and what we're going to talk to you about. And first, Sally Rocky is going to give an overview of this program, and then I'm going to talk about the Common Fund. Larry Borbrum's is going to talk about review of the applications, and then there's going to be a question and answer session with some of the coordinators of this program and also other members of the working group that are here. So I'm going to turn the microphone over to Sally, and here you go.
Thank you very much for having me. I'm delighted to be talking about the BEST program. This is really a culmination of many years of an examination of the biomedical workforce, and we're delighted that it's the centerpiece of the endeavor that's been going on. I'll start out by saying how this all came about. We had a subcommittee of the advisory committee to the director, who was chaired by Shirley Tillman, who's the president of Princeton, and myself. Our charge was to develop a model for a sustainable and diverse U.S. biomedical research workforce that could inform decisions about the training the optimal number of people for the appropriate types of position that would advance science and promote health. And then based on this analysis, really the work group was supposed to report out to the NIH so that we could take action on some of these recommendations. There is, you'll see on the slide, there is a number of places where you can get not only the report, but all of the other kinds of information about the data that we collected and how we use those data in our analyses are all available to you on the website. One thing I do want to point out that, like any good committee, we immediately changed our charge. As we dove into this, we realized that we wanted to concentrate on the PhD, which are those individuals who comprise about 75% of our current workforce. So that's where we kept our concentration. Through the course of our work, we came up with this model. This is not a quantitative model, it's more a qualitative model, and it's not a dynamic model. But what this model really does demonstrate is where those individuals who are getting PhDs in biomedical research arenas end up. And this is the first time that we have learned about the outcome of these PhDs on a more broad scale. So let me just run through this a little bit for you. This is information that we gathered from the NSF, who does the survey of earned doctorates. And what we concentrated again on PhDs in the biomedical workforce. These are individuals who got PhDs in the United States. It does not say anything about citizenship. It just means that they received their degrees in the United States and where they ended up. Some of this information is color-coded on the slide. Those that are in green are those that we have a lot of confidence in, the numbers we have confidence in. Those numbers in yellow, we have some degree of confidence, but not total confidence. And then those in red, really, it was somewhat of a crapshoot. We really tried to get the best numbers we could, but we're not very confident in those numbers. So if you look here, this tells you that the number of individuals that are in college graduates, 16,000 in 2009. About 70% of them do a postdoc, and 30% of them skip a postdoc. We also, if you notice over here, we have quite a few people coming in, particularly to the postdoctoral level, and those numbers are primarily in red. We do not track people well, particularly those individuals that are coming in from other countries. But if you look at the outcome here, these four boxes that are in blue or bluish color are those that we are really interested in learning about and also in setting a trajectory towards one of these four boxes in blue. But just let me go through all the boxes. Unemployment is very low in those that get PhDs in the biomedical research. This is involuntary unemployment. So this is those individuals, about 2% are unemployed. 13% of our trained PhDs go on into non-science related. This really should say non-research related because, for example, if you become a high school teacher, you will end up in this box here. And you're teaching science in high school, you end up in this box. What really surprised us and what we learned about was this box here. This is those individuals who end up in academia, either in a research position or in a non-research position. So if you are teaching only, you end up in this box. So this is only 43% of our graduates end up going to academia. 18% end up at the bench in industry. 6% end up in the bench, like in our intramural program in government. And another 18% end up over here in this box, which means research-related, but not conducting research. Those are individuals like myself who are in research administration. A large proportion of that 18% are individuals who are at industry and are in research management. If you notice again back in this box, only 23% of our entire PhD graduates end up in tenure or tenure track positions. So based on this, we are very interested in best preparing individuals for these 4 boxes because we believe that all 4 of these boxes are contribute in important ways to the advancement of the entire biomedical research community. So one of the things that we noted and was a conclusion is that while we are training these individuals, we are basically training them to end up in this box. We're training them to look like us who are training, and that is basically to become academic research scientists, yet only a minority of our trained PhDs end up in academia. So as a result of this, we had a number of conclusions, but we weighed all these data. The combination of a large upsurge in the number of U.S. PhDs and the influx of foreign-trained PhDs and the aging of the biomedical workforce make launching a traditional independent academic research career increasingly difficult. There's a long training time and a relatively long career salaries when compared to other disciplines, and professional careers might make this less competitive and attractive to the brightest of our young people. And the current training programs do little to prepare people for anything beyond an academic research career, despite the clear evidence that only a minority percentage of them are ending up in this career. So this led us to recommend a number of things. I don't want to go all through these because you can read them at your leisure in the report. But one of the reports was to really enhance the type of training that our scientists are receiving when they're going through their PhD to better enhance their abilities for the myriad of research and research-related careers that they're going to have when they get out. So this led to us developing this program that you're going to hear more about today, the BEST program, Broadening Experience in Science Training. We had 2 choices, the BETTER program, and I cannot remember what that was called, what that meant, but the BEST program seemed a fabulous acronym for this program. It is a Common Fund program, and it's really seeking innovative approaches to complement traditional research training activities in the biomedical research institution that will allow individuals to receive during the course of their PhD training those experiences that best prepare them for those 4 boxes that we saw on the previous slide. We're encouraging institutions to leverage funds with existing institutional office programs, local resources outside the institution, or partner with industry and other entities as a way to facilitate this program. We're going to include rigorous analysis to demonstrate the impact of this program. And what we're really thinking is that while we're only going to make about 25 of these awards, as these awards go on and we learn best practices, we want these practices to be implemented throughout the biomedical research community so that the entire community will benefit from what is learned from these awards. And there you'll see the guide notice for this award right below. And I think that's it.
Thanks, Sally. This is Trish again, and I'm going to tell you just a little bit more about the Common Fund first, which is where I work. So the Common Fund started around 2004 when the NIH roadmap was launched. I think most people probably remember that. It was an act of Congress, and as you can see, what it did was establish this division of program coordination, planning, and strategic initiatives that we call DPCIPSI. within the Office of the Director, and this is the NIH Common Fund. It's a dedicated source of funding to enable trans NIH research. This is a slide that gives you an idea of all of our current Common Fund programs, and they vary greatly from things like single-cell analysis, extracellular RNA communication, protein capture, etc. And here in red is this program that we're talking about today, strengthening the biomedical research workforce. Now, we have pretty high standards and pretty tough criteria for Common Fund programs. The programs have to be transformative. They really have to have the potential to make a very big difference, to really change biomedical or behavioral, social science, or clinical research over the next decade. They're to be catalytic. We have very high impact goals, and they're going to be short. They're going to be 5 to at most 10 years. This program is going to be 5 years long, and really that's it. They should be synergistic. They promote the missions of multiple NIH institutes and centers to benefit health, and that's obvious to see here with this award, how this could cut across all the different institutes and centers. It's relevant to many diseases, and it's going to be about training. It also has to be unique, and it's something that nobody else is likely or able to do. So we have, again, very high criteria. What makes a program common fundable? And this is a word that we throw around our office a lot. Is it common fundable? And with respect to this program, this is what's common fundable about it. We're trying to affect a sea change. We really want to make a big cultural change with this program. As Sally explained, we really want to alter the whole training landscape. We want these new approaches and new techniques approaches really to be disseminated throughout the entire training landscape eventually. The idea is to give trainees an idea of what they could do to end up in one of those 4 buckets, and not necessarily train them to be that career, but give them the information so that they can do that once they perhaps finish their PhD. The other thing that this award will do is enable infrastructure so that novel courses and curricula can be established, internships and other training opportunities can be enabled. So that's what led to this program, strengthening the biomedical research workforce. It's a novel opportunity, I think, and it's very common fundable in that it's going to be very different than any other training exercise that all of you have been involved in, we hope. So, as Sally said, despite all of these options, most graduate programs and postdoc training programs focus almost exclusively on preparing individuals for careers as academic researchers. I had my own lab for 15 years, and I know that I was best prepared to train somebody to take my job. And that's perfectly reasonable, but now we know that we need to do better and to do differently. So what we want to do here is find applications that are going to establish, implement, and assess, and the assessment is very big, these different approaches and activities to complement what's been going on already in all of these different biomedical sciences. Very importantly, this is intended to be an experiment, which might mean it fails. This is not a training grant. This is not what you're used to. It's really going to be different. There's 2 major goals. And that one, of course, is to better prepare those students and postdocs for all these different careers, but also, as Sally referenced, to establish this network to really craft what are the best ways to do this and to disseminate those best practices throughout the entire training community. To give a little bit of nitty-gritty, because this is some of the important stuff, yeah, this is $250,000 plus full indirect cost. And this also, as we go through, please send your questions to that email, but I think we're going to answer a lot of questions that we've already received. So it's full indirect cost, not the normal 8% that you're maybe used to with training awards. It's a 5-year award, cannot be renewed. Yes, you can put faculty, staff salary on it, and these are the people that are actually going to be establishing, implementing, and assessing the award activities. No tuition, stipend, or salary for students or postdocs. This is not a training grant. This is not a mechanism to have more students. You can pay for consultant costs, equipment that are necessary for training, and other things like this. If you're not ready, we understand, if you're not ready to submit this by the deadline that's coming up, there will be an additional call for applications in 1 to 2 years. The funding opportunity announcement will definitely not be identical to the one that you're looking at now, but it will be similar. Eligibility, you have to be a doctoral degree granting institution. The pre-doctoral program has to be established already. If you have postdocs, you have to include them in the program. And that's kind of a fuzzy statement, a significant number of postdoctoral scientists, but I think that you can, if you only have 2 at your whole institutions, I think you can argue that that's not significant. The training activities have to be available to every trainee regardless of their funding source, not just if they're on a training grant or an NRSA or something like that. They're not intended, the program's not intended to reside within an individual department. It should go all across the school and perhaps between schools. We'd be very happy, very excited to look at applications that are going to leverage existing resources and broaden them and really try something new and different. You want to craft your applications that you have different, various career paths, not just one in a narrow focus. The other thing is that the training opportunities have to be meaningful. And that doesn't mean just sitting in a room and listening to somebody talk about what they do every day. That could be part of it. But we'd really love to see hands-on opportunities. The trainees don't have to. These should not be required courses or experiences, but they should have the opportunity to select between different experiences. And again, as I said earlier, it's not meant to train them completely for the career option, but it should prepare them for what they need to do next. So one goal, and we've listed a couple different careers there, but Sally already mentioned the different buckets, but we'd like to see that they're better prepared to undertake careers in industry, government, academia, and entrepreneurial enterprises. We absolutely expect that the ones that go into that third bucket in the academic research careers can benefit from these experiences. However, if the program's designed to only target that career, that would not be responsive. It has to be broader than that. That's the B in the BEST award. We would be happy to see the design of exit pathways that are not punitive, that are positive and attractive for individuals that intend a career that they realize they don't need a PhD to pursue. And the design of that should be up to the applicant. It could be degree granting, it might not be, it's up to them. So this is a long-term goal of the program, is really to craft new models of how graduate programs might function in the next 5 to 10 years, how they will recruit, admit, support, steer, and mentor students to prepare them appropriately. We do not expect that all the new programs would have to give the students experiences in every single research or research-related career, but the program should target things that will synergize with their existing programs and sort of work holistically across the whole enterprise. A few more details. A lot of people have asked about who the PI should be, and it can be any individual that's appropriate, really. They should be an established investigator, and I think you all know what that means. They should have a track record in career training, career development, or something related to that. They will be responsible for monitoring and assessing the program. They will have to be the person that submits the progress reports and other required documents. Multiple PIs are definitely allowed. There's a multi-PI plan that needs to be submitted if you choose to do that. So co-PIs are allowed. They can be at another institution. We don't specify a percent effort that the PI has to put on the grant, but that will be considered in the review. Partnerships, we really want to see partnerships. We want to see people brought in and work together with academics so that people that actually have hands-on experience in all these other careers will be the ones that are help training the PhD students and the postdocs for those careers. This might result in internships. It might result in novel courses or curricula or other experiences. One of the things that we'd really like is we know that a lot of you out there are already doing wonderful novel things, and we don't want people to think that they are already doing this so they can't apply. We would love to have your even more novel ideas submitted to this award. However, we don't want an award that would just maintain an existing program. So it has to, if you already have really cool things you're doing, explain how this new stuff is going to be even cooler and even better for the trainees. So as I mentioned, this is not going to be a departmental specific sort of program. It should be multi-departmental, maybe multi-program, multi-school. So reach out to the business school, the law school, whatever it takes and whatever works for you in your environment. We really want the culture to be transformed, as I said, a sea change, and we want this to happen for both the trainees and the mentors. One of the things that's going to be very important is how well the mentors are buying into this, how many of them are putting their students through these activities and participating in them. We'd like to see applications that leverage funds. As you know, this is going to last for 5 years. So after 5 years, somebody has to be paying for these activities, and the idea is that they're going to be so important that they will be maintained. As Sally mentioned also, evaluation is a very big component of this program. It's meant to be an experiment. So with any experiment, you have to figure out if the experiment worked or not. So we're going to do this on 2 levels. Every individual award will be evaluated by the individual awardee, and there are a lot of questions in the back of the FOA that you should look at and think about how you would evaluate using those sorts of metrics. At the same time, NIH will have independent evaluators that come in and evaluate each individual awardee as well as the program as a whole. And the other thing that's very important about this is that we want the successful approaches have to be widely disseminated throughout the training environment. This is going to be a very interactive network. Best awardees are going to get to know each other very well if you don't already. So we'll have an annual meeting where people will discuss their experiments, their progress with the training. There'll be a kickoff meeting here in Bethesda in October. There'll be monthly teleconference calls, and you will receive site visits from your NIH staff people, including me and other people in the working group. Here are the important dates that you probably have already written down in your calendar, I hope. The first one is a letter of intent. This is not required, but we really want you to give us letters of intent. I've already received a couple. This will help us prepare for the review, and I think that everybody wants the review to go as well as possible. So therefore, the more people that we know about, the less surprises we have. And you know, this is an email to me, so this is not a document that's going to be included in your application. It's an email to me. It's non-binding. And it'll also help us to choose reviewers for certain things, as we want to have the right reviewers in place to review this. It'll be reviewed in June or July this year, and it will start at the end of September with that meeting at the end of October. So now I'm going to turn over the slides to Larry Borboom, and he's going to talk to you about the review of this program.
Good afternoon, and thank you, Dr. Lebowski. The review will be held at 2 levels, which is typical of all NIH grant applications. The first level of review is the typical peer review or study section review, as we typically call it. And I want to emphasize that these applications will be reviewed in meetings that are set up specifically for the purpose of the best awards. There will be no other activity codes reviewed in these meetings, and the reviewers selected will be recruited for their expertise specifically to review these applications. The number of meetings that will be held is unknown at this time. It'll be a function of the number of applications that we receive. The time frame for the review is going to be in June or July. No specific dates have been set yet. The second level of review will be by a National Advisory Council, and this meeting will take place on September 9th of this year. Typically, for all applications, reviewers will write an overall impact paragraph for each application, give an overall impact score, and also give comments and scores for each of the 5 criteria, which include significance, investigators, innovation, approach, and environment. Scores for these applications will be the same as what we usually use, with 1 being the best score and 9 being the poorest score. Again, these are the scored review criteria, and I will speak about each of these in more detail in the coming slides. First criterion is significance. And in this regard, the reviewers will be evaluating if an important need in scientific training is being addressed, and if there is convincing evidence that the proposed activity will significantly contribute to enhancing the training of the future biomedical research workforce. With regard to investigators, the reviewers will be evaluating if the investigators have the ability to lead, develop, and implement the program. They'll judge whether the level of effort being devoted to the program is adequate to assure its success. They'll be considering whether the faculty have the necessary experience in mentoring students, teaching science, or other aspects of research and research-related careers. For the purposes of this program, experience or knowledge in research-related careers would be an asset. Reviewers will be considering whether the scientific and career accomplishments of the faculty make them good role models for the participants in the program. They'll be asking if the investigators have complementary expertise, and if there are multiple PIs, the reviewers will be judging whether the leadership approach and organizational structure for the project is appropriate. With regard to innovation, questions that will be asked are, do the proposed experience have an innovative nature? Will the program develop and utilize innovative approaches and use up-to-date best practices to improve the knowledge and skills of the program participants? They'll also consider whether the proposed program goes beyond traditional graduate student and postdoctoral training activities. And Dr. Lebowski has commented on that need already. Concerning approach, we'll be asking if the goals and objectives are stated clearly. In other words, will what you want to do be easily understood by the reviewers? So it's important that you make your application very reviewer-friendly. Are partnerships in place to provide unique training opportunities? This is not required, but it is strongly encouraged. Is there an evaluative component that will make it possible to meaningfully judge the success of the program? This is important. I emphasize it again. Dr. Lebowski also pointed this out, but this is an important part of your application. Are adequate plans in place for recruiting a highly qualified and diverse participant pool from across the institution? Again, we're not looking for a single department, but as broad an exposure to students and postdocs as possible. Is there a detailed dissemination plan presented for sharing the results of the program? And is there both short and long-term institutional commitment for the program? With regard to environment, will the scientific and training environment contribute to the goals? Does the environment outside the training institution provide opportunities that enhance the educational value of the program. This can be related to the partnerships that we discussed earlier with regard to the approach criterion. And again, is there evidence of institutional commitment to the program? Is there evidence of faculty commitment? And if appropriate, is there evidence of broad collaborative buy-in among departments, centers, schools, and other institutions? Finally, I want to point out that it is generally NIH policy to devote review time to the most meritorious applications. Therefore, if a large number of best applications are received, it is possible that not all of them will be discussed. And if not all applications are discussed, the selection will be based on the preliminary overall impact scores. The applications that are discussed will be discussed in rank order, beginning with the best applications. And I should also point out that the non-discussed applications will receive a summary statement, and you will get the criterion scores. So after the peer review for scientific merit, the applications will then go to the advisory councils for the second level of review. Thanks.
Thanks, Larry. Now I'm going to open the floor up to questions, and by the floor I mean the email address that you see on your screen. The questions are going to be de-identified, so you can share some really novel sort of thing if you want to, and we won't tell who gave us that idea. The other thing that's important, I probably should have said at the beginning, is that these slides and an audio recording of the webinar is going to be available on our website, probably not today, but maybe tomorrow. It'll be up, you can download and listen to this, and the slides will be up there as well. So I'm going to start this by, I'm going to read the first question, and I'm going to ask Sally Rocky to answer this question. And then we're just going to read questions and answer them from the group. So one of the questions that we received in multiple formats is that if graduate students and postdocs are on a training grant or funded through an R01, they're supposed to be 100% effort on their research. So how can they be involved in activities that would take them away from their research? How can we stick to the compliance that's expected in our R01s?
That's a great question, and actually we had this question just a few months ago that I responded to on my blog called Rock Talk. So it's an important question. I think there runs a little bit of confusion about the answer or the question itself, but basically there's two ways that you support graduate students and postdocs. You either support them on a research grant or you support them through a training grant. A training grant is an easy answer. Most of our training grants and fellowships, the individual is considered 100% training, but training means many things. So doing things extraneous than just the bench work that an individual will be doing and actually conducting the research is totally appropriate to the training grant position. So we expect that the types of activities that an individual is going to participate in through the BEST program will be appropriate for considered part of the training activity. On the other hand, if you are brought in as a postdoc on a research grant, you actually have an employee-employer relationship with your institution. But the institution has the right to put whatever is appropriate in that agreement between an employee and themselves. So they can work, and your institution will know how to do this very clearly to make sure that when an individual is receiving training under a research grant, an RPG, that they will be able to participate in the types of activities that are going to be promoted through the BEST program. So it's a pretty simple answer. It's not when you want a full cadre of experiences as an individual, including things like writing, participating in conferences, writing publications, participating in some of the activities that we might see here, like gaining an entrepreneurial experience or working with industry. It certainly would be appropriate on the training grant and on the research grant, as long as it's worked out in the agreement made with the institution.
Thanks, Sally. That seems pretty clear. Okay, so I'm going to read some more questions, and we're going to answer them for you. So does every proposal submitted have to prepare all trainees for all career paths. And another way to say that was, would NIH fund proposals that focus on a smaller but important subset of career paths? And I think Allison's going to answer that for us.
So the best proposals are really looking for culture change within our academic research environments. And they're really seeking to have additional career opportunities laid out for students in this training path. So they don't have to train for all possible career opportunities, but they do need to be providing the skills and knowledge for students to select among the multiple career opportunities available to them, and at least have career opportunities in addition to academic research. I think this is a case where the more is merrier, but it is not a defined number.
Okay, great. Sort of along that line, looking at sort of what the scope of this program will cover, would the program that we're proposing have to be mandatory? Does it need to be required for all the students and all the postdocs at our institution? I guess Steve is going to answer that one.
That was an easy one. No. It should be available to all who want it, but it's certainly not mandatory for anybody.
Okay, so this is a little more complicated question. Could we propose an interdisciplinary, multi-group, innovative program, quote unquote, from scratch, with the understanding that it might take 12 to 18 months to actually launch this, given the complexity of approvals, certification, development of new courses, etc., and that all these details are not currently worked out before the work would start in the end of September? One of you guys want to take a stab at that?
I'll take a stab at that. So I think, first of all, yeah, I mean, people can propose whatever they want. Again, I think the emphasis needs to be on providing the opportunity for these PhD students and postdocs to explore other career opportunities besides bench research or clinical research. And if you have some great idea that's going to take a while to implement, then in the proposal, you need to be very clear what the timeline is and how you're going to measure whether you're reaching those milestones. I guess it's not really milestone driven, but you can think of it like that. And so we're looking for people to be as creative as they can. I guess I would like to emphasize the purpose of this is not to develop new training programs. It's not the creation of a training program independent of what you're already doing for research. It's providing knowledge and opportunities so that people can choose from among a number of different career options that their PhD training will get them to.
Sort of along those lines, somebody asked, can we start with a pilot group of trainees? So can we start with maybe the postdocs first in year one and then roll out the program after that to the graduate students? Or does the program need to be open to all the students from the very start? And go ahead, Elle. Oh, no, Sally, go ahead. Thank you.
So, no, it doesn't have to be available to all the students or postdocs at the same time, and you could stage it in a number of different ways, but I think we would probably be more receptive to one that started with the graduate students instead of the postdocs. I think that if you were going to pilot it, that would be the thing we'd want from the onset.
Okay, here's one. We are not a degree-granting institution, but we are affiliated with a medical school, and we have grad students in laboratories. Are we eligible? And I'm going to answer that one and say no, unfortunately not. You have to have a degree-granting program. You are, however, eligible to be one of the partners. And maybe you should talk to the people that are up the road or across town or whatever about maybe being a partner to help get your postdocs into their program and get your students working with them and providing some really different opportunities. Another one that came up a couple times is, what's the definition of an attractive exit pathway? What do you think those might be? And Are you expecting that those exits would be accompanied by a master's degree or certificate or something like that? Because really, usually those master's, MS's degrees are looked at as suboptimal. So what does it mean to provide an attractive exit strategy?
An attractive exit pathway is really needed for quite a few students who embark initially upon PhD training and then identify somewhere along the path that this is really not for them, and perhaps that even the PhD itself is not required for a successful career in the biomedical workforce. Depending on when and where that student has identified these ideas, it might be possible for the student to earn what we sometimes call a conciliatory master's within their program that acknowledges the academic work they've done. But I think we're looking for a very different answer here. We're not looking for just stopping the PhD and walking out the door, but for specific training and skills or knowledge to apply what they've already done in a new kind of career outcome. I don't think that we're very interested in spurring a small industry in master's programs and certificate programs to acknowledge these students. We really are trying to address the career opportunities needed for students who initially began in a PhD program and somehow decide that that degree is no longer required. So there's a lot of flexibility here.
Yeah, I like that. I mean, we're really looking for things that are creative and different and innovative. So I want to switch gears just a little bit and talk a little bit about, I have a lot of questions here about the PIs and who could be the PIs. So one, would NIH consider a proposal from a scientist and an expert career counselor with no background in science or research and no co-author publications? Is the expert career counselor a viable co-PI? Who wants to take that one? Steve? Steve wants to take that one.
I'm going to give a standard answer, which is whatever you propose for your program, the PI should be the appropriate person to run that program. And that'll be up to reviewers to decide whether the PI is the appropriate person to be running that program. NIH isn't picking and choosing who it wants to be running the program.
Okay, that's great. There's a few more questions that sort of fall under that, like will PIs be required to have current NIH funding as part of the review criteria? And then I think I'll echo what Steve said. I think it depends. I think it depends what their focus is, and you know, we want the best role models and the best people to be the PIs. Would PIs who are faculty members be considered more favorably than people who are not faculty but have a strong experience in career development? I think it's the same answer again. It's going to depend on the reviewers, and you're going to have to make the case for the application, for each application. A little bit more granular, is there a limit to the number of co-PIs? And I'd say no, we didn't put a limit on that. I think it has to be reasonable, and the roles of each person have to be very well laid out. Can the co-PIs be in 2 universities within a state system, university system? Sure, absolutely. Can they be in 2 schools on the same campus? Absolutely. The more cross-cutting this is, I think the better, really. Okay, here's an interesting question. Yeah, please.
Add something to that statement. So the more cross-cutting it is, the better, but it's important for the applicants to make the case that it will work and that these different entities will actually work together successfully.
Yeah. Here's a question that I hadn't seen before. Can vet or med students be considered grad students? Yeah, Sally answers yes, absolutely. Yes. Yeah, we're interested in doctoral programs, so vet and med is fine. What we're not interested in is to design the program to fit into that one bucket.
Dr. Lebowski, but I think we would be looking for those individuals to be developing themselves for a non-clinical patient care sort of career. Is that
absolutely
correct?
Yes. Okay, clarify, quote unquote, available to all students. not everyone can participate in an internship program. Well, that's true, yes, but the point is that it wouldn't be just an internship maybe for the pharmacology department. I'm making that up. I have nothing against pharmacology. But it should be available to any students in the area that would be interested. Okay, what is required to show that a collaboration is in place? A letter of promise, a CV from a collaborator?
I think any evidence that can be provided, if the collaboration is merely speculative, you have to remember that you're going to be competing with other applicants who are going to present evidence that there are partnerships in place. So it certainly will be helpful if you can provide solid evidence.
I think that's true. And one of the related questions is, where does the stipend support for the internship come from? And yes, it can't come from this award, as you know, but one of the things that would provide evidence of a genuine partnership is if there was a partnership with industry or something like that, and that partner was willing to contribute to something like stipend for postdocs or students. Let's see. Here's a review question. Will study section be scientific or will it include educators? Who will be the members of the scientific panel?
The reviewers will consist of a variety of individuals. There will probably be a fairly good representation of graduate school deans, individuals of that type. Certainly people who have experience in training graduate students, postdoctoral students.
Yeah, sure. For a T32 or an NRSA, the percent time for training is often small. So how do you keep these experiences from being dabbling? Well, I think that, again, is going to be up to the applicants. I think that it has to be a meaningful experience. It doesn't often take a large percent of time for something to be meaningful, but I think that's what you're going to have to convince the reviewers that it's meaningful. Now, Steve has a correction for something that...
I don't know if it's a correction or a clarification or a muddying or something. There was a question before about whether it's appropriate for medical students or veterinary students, and the answer was yes. I actually have trouble imagining how this would be appropriate for a medical or a veterinary student. You have somebody going to medical school and you're providing an opportunity for an alternative career. It's not clear to me how that's applicable to a medical student. That said, if you come up with a program that is appropriate for them to participate in, we wouldn't stop anybody from participating in it.
Or dual degrees, yeah.
Right.
Yeah. Okay, I'm going back to review here. I think we sort of answered this, but how will review committee be comprised so that they're not traditional and they will be encouraged to review bold new approaches? And I think Larry answered that, but what I can tell you is that we were going to meet with these reviewers beforehand and explain to them how this is going to be a bold new experience. Did you want to add more to that, Larry? I think you already answered this.
We will certainly have a training session, as we always do with reviewers, to explain to them the details of what this program involves, specifically what it's intended to do, and that it differs from reviewing scientific applications, differs even from reviewing training grants. So the reviewers will be well instructed.
Okay, here's a question. If a company, so I guess someone from a company is out there on the webinar, if they're interested in partnering with an institution, can we find out who's applying? And I don't think there's really a way to do that. I think that all I can encourage you to do is to reach out to neighboring institutions that you might have relationships with the collaborators or anything like that, to figure out and maybe encourage them to apply, and you guys could do something exciting and interesting together. Okay, are administrative salaries allowed in the budget? Yes, I think we covered that. They are. Is this a modular or a full budget? It's a modular budget. A question about evaluation. Are we expected to have external evaluation or can it be internal? And I think, again, that's up to the applicant. It can be either. They have to decide. Allison, you wanted to add in on that.
So evaluation is a key component of this proposal, and I think it's very likely it will involve both internal evaluation by the institution or partnerships together to try and understand what their career development interventions actually did. So did they understand well enough the participants' career intentions at the beginning of the program? Did they understand them at the end? Do they understand where their trainees normally go and if it's any different after they've done this program? So those sorts of things are going to be very important for the institution to understand, to know if the program worked for them. I think the NIH is going to also have interest in looking across the programs to see how well any of the institutions did with their very specific and locally responsive needs. So I think there will be both things at play, and in fact the proposal requires at least the institution to outline what they're going to evaluate and why.
Also on some of the evaluation questions, there's a couple questions. We mentioned that a logic model might be an example of what an applicant could include, and someone asked, is there a specific logic model format you recommend, similarly for the evaluation plan? And the answer to that is no. I think you have to choose what you think works best. But someone asked another question, and I think this is a sticky one. Can you comment on the logic model process, since outcomes take many years to realize? And I think that we're limited with the time frame that we have. So I think, go ahead, Allison.
So I think that I actually am one of the few fans of logic models, but I think that the logic models will help you identify what short-term goals are involved and what medium and longer-term goals are involved. And it's very, very useful to have help from an evaluator or somebody with that expertise before you set up your program, so that you know what you're intending to change and you can measure it along the way. So there's no specific model, because I think we imagine that these programs might take very different forms. There might be courses or internships or tech transfer activities, and they may have very different outcomes in the short and medium and long term.
I think just to add something to that, the goal here is not necessarily that you will come up with an evaluation at the end of 5 years and know the answer, but hopefully these are not 5 years and done, but that things will change and that this will go on. And the plan is that you have an evaluation plan so that it can be evaluated when the time is appropriate and changes can be made.
A similar question came in that just said, if the program's 5 years but students take 5.5 years to degree, how do you assess them? So I think that, obviously, I think we sort of just answered that, but it's going to take longer, and hopefully you have students graduating all the time. Let's see. Can sub-programs target particular groups of trainees, for example, veterinarians? I don't know exactly what a sub-program is, but go ahead.
I don't know why we're targeting veterinarians. I don't understand the question.
Can sub-programs target particular groups of trainees, for example, veterinarians? I think, if it was one small part of the program, that might be okay, but we want the program to have the potential to reach across the whole biomedical research enterprise, and I think you have to keep that in mind as you're planning your applications. Okay. We have multiple schools, medical, dental, public health. Can we submit more than one application? And I'll tell you that the application goes by DUNS numbers. So if your different schools have different DUNS numbers, then yes, you can. But if not, then no, you cannot. Could the program include social science, environmental health, biomedical engineering, etc.? Go ahead, Steve.
It's up to the applicant to decide what their program is going to look like. Again, the goal here is to make available to PhD students in a research program a knowledge of the opportunities that are out there and the ability to take advantage of them if they don't want to continue in research.
Can applications that focus only on postdocs be considered responsive?
No.
That was easy. Okay. Can you clarify that the proposal cannot be to develop a new program. I don't quite understand that. We have a program, we're hoping to start it next year. Go ahead. Yep.
I think we're looking for new programs.
Yeah, that's the point.
What we don't want is to continue an existing program.
That's true, but at the same time, go ahead, Elson.
But we also don't want something that's impractical or doesn't fit the environment or will have no effect within the time period that is outlined. So I think what we're looking for is an institution that has already taken steps to consider the multiple career opportunities available to research PhD students and thought of novel ways to train them in a broader range of opportunities or with new opportunities that weren't existing on the ground. I think there's some trepidation in looking at a proposal which really has no infrastructure to do career development among these trainees. So I think you want to have a program which you may be broadening, widening, deepening, partners, or very novel approaches.
Yeah, and I guess another point that I think I've said, but I want to stress again, when it's confusing language when we talk about a new program. These should be new programs and that they shouldn't already be existing.
Right.
But we're not looking for new programs that will cause the recruitment of a different batch of students that want to head specifically into some new program. It's not like we're looking for vocational training or some kind of new entity. We're looking to broaden the opportunities available to students who go into PhD programs to do research, and there are lots of different things you can do besides get an academic position. We want students to be aware of those things and to have the skills to branch out and go for those things.
I think that was well said. Okay, I'm going to switch gears again a little bit. I don't quite understand this, and I think the answer is no. What's the relationship between this program, this Common Fund program, and the training opportunities through the BD2K program? That's Big Data 2K. Could an institution develop training programs related to big data? So I think they could, but it shouldn't be focused on only big data. So yes and no, I guess, is the answer to that. Here's some nuts and bolts things. What do you mean by dissemination plan, and how detailed should this be? So are you going to publish the work? Are we going to meet and give posters at the GREAT meeting, for example? Are we going to, disseminate what your plan is and what your results are? I think that's what we mean.
Right, so I think how are other institutions going to benefit from what you learn?
Okay. Would global health research training for med students in resource-poor countries be considered? And I think the answer to that is no. That's a highly specific health training that is admirable, but I think that doesn't fit the criteria for this program. Can there be themes within programs to anticipate national need and high market value disciplines? Absolutely. I think that, if you are located in an area that has a need for a certain type of scientist or science training, it'd be great to craft your program towards that. How much interest is there in interinstitutional collaborations? I think if it fits, we'd like to wear it. So yes, I think that could work. Sorry, we're getting tired over here. Okay, this is another nuts and bolt one that I think is important. I've had it a couple times. Is there a preferred structure for the research strategy? Should it include sections found in other R01s? Now, this isn't an R01, but in other R01s like significance, innovation, and approach. So what you need to do, you use the form 398, which is just a blank form. You get 25 pages, and you basically have to cover everything, all the various areas that are going to be reviewed and that are outlined in the FOA that we've gone through today, and that especially that Larry's gone through, what the reviewers are going to look at. So you have to cover all of those things in that 25 pages. And what I would say is make it as easy for the reviewers as possible. For program faculty, will all faculty biosketches be required? And I would say yes. Who should be listed other than the program director? Anybody, any staff member that you think is going to be critical for the development of the program and needs to be also paid from the award? Let's see. Yeah. Oh, we're coming up on 4 o'clock, so I've got 2 more questions here that I think are important, maybe 3. We already did that one. For future RFAs, will you give us more time between the RFA posting date and the due date? And the answer is yes, we will try. At this point, what you can imagine is that we'll probably have another RFA on this in a year or 2. And if it gets close to the time and we don't have a lot of time, we will post a notice beforehand that's a little shorter than the RFA, but I don't imagine it will be as difficult to get this out, and the second one out in a timely manner. Are there more workforce RFAs similar to BEST that will be released? I'd say only the second one in the BEST program. This is it. This is the award. This is the program. And I think I'm going to close on a really down note. And the question is, will sequestration affect the BEST award? Can you believe that? That's the last one. So yes, unfortunately, everything will be affected, but we don't have specific answers on how that will be affected yet. So we'll get to that. We'll let you know when it happens. And I think that's all. And it's 4 o'clock, so we're going to say goodbye. So you can continue to send us more questions. You can either send them to the mailbox that's up on your screen, or you can send them to my email, which I know a lot of people are doing already, and I'm happy to try to answer those. Or you can send them to Allison Hall or Steve Korn. So thanks again for coming, and we're looking forward to seeing applications and meeting with the BEST awardees in October. Bye.